So maybe we can go to the next presentation by the Professor Gilles ORLIAGUET, who works in Paris and who will give a presentation about education in pediatric anesthesia. Let's go.
So thank you, Isabelle. Dear colleagues, during the next 5 minutes, I would like to share with you some reflection regarding education in pediatric anesthesia. Clearly, up to now, there is no consensus regarding education in pediatric anesthesia. However, there are some European guidelines for training in pediatric anesthesia which date back more than 10 years. Anyway, the main objective of education in pediatric anesthesia are the acquisition of adequate knowledge, cognitive skills, and competency, with an ultimate aim, which is to make anesthetic safe for kids. And I would like to remind you the SAFE initiative with the 10 N, which are, for example, normothermia, normocapnia, normotension, and so on, to maintain physiological homeostasis for safe pediatric anesthesia. So I would like to share with you now some points regarding basic specialist training and it works alone. And now I would like to speak with you about the basic training program. Basic training program in pediatric anesthesia are for all trainees in anesthesia, regardless of their future career. Basic training program should include at least 3 months of continuing training in a specialist or in an academic pediatric center. During basic training, a trainee should anesthetize a sufficient number of patients within the different pediatric surgical specialties across different age group of patients. It's quite difficult to define which is a sufficient number of patients. Some authors suggest that trainee during basic training should at least anesthetize 10 infants less than 1 year of age, 20 children aged 1 to 3 years, and 60 children aged 3 to 10 years of age. Now let's move to specialist training program in pediatric anesthesia. For trainees with an interest in pediatric anesthesia, that is to say trainees spending less than 50% of time in pediatric anesthesia, a further training module of at least 6 months is required. For trainees who wish to acquire a specialist position in pediatric anesthesia, which are trainees spending more than 50% of their time administering pediatric anesthesia, a further training module of at least 1 year is mandatory. And for trainee in both these advanced training modules, an internship of at least 1 and 2 months in a pediatric intensive care unit, respectively, is required. The training program in pediatric anesthesia should include both theoretical courses with basic knowledge which are summarized on this slide, as well as practical training in the operating room to improve and develop new skills and competency. When clinical exposure is inadequate or unavailable, simulation-based training may be very, very useful, especially in situations as anaphylaxis, laryngeal spasm, or cardiac arrest. Now, let's have a look to assessment and supervision of training in pediatric anesthesia. Supervision in pediatric anesthesia should be performed on a one-to-one basis. Assessment should be performed both during and at the completion of training and should include reviews of logbook, interviews and reports from supervisors, as well as simulation-based assessment. Teaching and supervision must be adjusted to trainees' experience and clinical situation. For example, in infant less than 1 year of age, teaching and supervision must be performed during the whole surgical procedure. Before concluding, I would like to discuss with you continuing medical education in pediatric anesthesia. For the European Union of Medical Specialists, the aims of this continuing medical education are to keep abreast with new developments, to develop new professional skills, and to promote continuing professional development. In the setting of pediatric anesthesia, I would like to suggest reading textbook and possibly published paper of the pediatric anesthesia literature, to attend meeting and refresher courses in pediatric anesthesia, and I suggest you attend the next, ESPA meeting, to familiarize with cognitive aids for critical event, for example, this Pedi crisis published by the Société for Pediatric Anesthesia. And last but not least, to practice pediatric anesthesia on a regular basis to maintain both skills and knowledge. So, thank you.
So, thank you very much, Gilles. The first question could be, what is the place of simulation-based training in pediatric anesthesia?
So clearly, simulation-based training occupies a growing place in anesthesia, and especially in pediatric anesthesia. Simulation may be used as to improve clinical experience and to allow the safe acquisition of skills before actual patient care. Situation where clinical exposure may be inadequate or unavailable, such as, for example, anaphylaxis, cardiac arrest, and so on, may be addressed using simulation. Simulation can be delivered using very different methods, ranging from task trainers to high-fidelity simulator, and can be used to train new or complex skills, to develop professional behavior and non-technical skills, and can also be used to assess or test a candidate response to specific critical events.
So thank you. We have a very interesting question from one of our viewers from Madagascar about education in pediatric anesthesia. Should nurse in anesthesia also have a specific level in anesthesia training in pediatric anesthesia?
It's a very interesting question, and I agree with the fact that a registered nurse in anesthesia should have a specific course to develop as well skills and acquire knowledge in the specific setting of pediatric anesthesia. Yes, I'm sure it's very important to improve safety.
How can we check that?
I think for nurses also there should be a specific program, training program, which may be very similar to programs suggested for trainees in pediatric anesthesia. However, they should be shorter in duration, and maybe with less basic science and so on, but maybe with much more skills, technical skills.
Okay, and you said in your presentation that 3 months, a duration of 3 months was mandatory for all the anesthesiologists. Why 3 months?
I think that 3 months is clearly the minimum duration of a course in pediatric anesthesia. In France, we try to develop a duration of at least 6 months, but I think also that during these 6 months, you may spend 3 months in the operating room, developing skills and competency in anesthesia, and maybe 3 months in the ICU, in the pediatric intensive care unit as well.
So we have a question
yeah,
from
I
Walid.
have a question for you, Gilles, because we have a problem in Europe. I'm just taking, you know, like a snapshot. What's happening in Europe is that the training for anesthesia varies between 2.5 years to 7 years across countries in Europe. So, and not all our future anesthesiologists in Europe will have these 3 months. That's a problem. We have a problem for curriculum. Second point I would like to highlight is that in Europe, at least, only the UK and France, to my knowledge, have this 1 year of additional training. Scandinavia pushed it to 2 years. And that makes sense, because if you look at one very recent study coming from Canada, where they have shown that within 1 year, you do not face all the challenges that you have every day. There was a lack of training in regional anesthesia and pediatrics, and also to challenge all the congenital disease, all the metabolic, all the cases that we face actually, and what we've observed in apricot.
Yes, I agree with you, Walid. The proposal were very minimum duration of training, because we have to face with the possibility of to give an environment, an academic environment, and you are not able to propose such environment in every hospital. So you have to put these trainees in academic hospital, in a setting where they may be an improvement in both their knowledge and skills, and as well in non-technical skills. So I agree, it's a problem, but we have to do with that.
So, according to you, Gilles, is a training in intensive care unit should be mandatory for pediatric anesthesiologists?
Yes, it is. For me, the knowledge and skills which is acquired during training in the intensive care unit may improve the quality of the care that the trainee can and the practitioner can deliver in the operating room, especially for complex case, especially for children with comorbidity and for small kids. So this is an integral part of the training for me, and it should be at least, I give you some number, 1 and 2 months for me, for someone which to give a career with more than 50% of their time in pediatric anesthesia. It's at least 1 year of training in the ICU, in the pediatric ICU.
You want to add something?
Do you think we should also invite PQ trainees to come in the operating room for 1 or 2 months?
Yes.
That's what happens in Switzerland.
Yes. May benefit from exchange. So yes.
Absolutely. So in the OR, who can supervise a training in pediatric anesthesia? Because sometimes it's difficult, you know.
So during the in the OR, you have to show some aptitude and willingness to teach, and of course you have to perform regular clinical. You have to regular clinical commitment in pediatric anesthesia to be able to give some good
practice.
Teaching. Thank you. And teach. Clearly, trainees in anesthesia must be appropriately supervised when anesthetizing children. And moreover, in any case, each trainee must be under the responsibility of an identified consultant, which may be available to advise and assist the trainee as appropriate.
Okay. And for the previous question, the first one about the minimum age for LC children to be anesthetized by a non-pediatric anesthesiologist, what do you mean? What do you think about that?
I agree with Walid. The 3 years seems from the apricot data an adequate age, because under this age there are an increasing number of complications and you have to have before developed adequate skills to deal with this important respiratory or hemodynamic complication.
So, thank you very much, Gilles.